Schizophrenia. It's one of the most misunderstood mental health conditions in the world. But here's the truth. With the right treatment, understanding, and support, people with schizophrenia can live full, meaningful lives. In this video, we'll break down everything you and your family need to know. From what schizophrenia really is, to how to manage symptoms, medications, and daily life at home. So if you or someone you love is living with schizophrenia, stay tuned. This might just change the way you see recovery forever. Schizophrenia is one of the most misunderstood mental health conditions in the world. But at its core, it's a serious brain disorder that changes the way a person thinks, feels, and behaves. It can make it hard to tell what's real and what's not. Some people may hear voices that no one else can hear, or see things that others don't see. These experiences are called hallucinations. Others may strongly believe things that aren't true, like thinking someone is watching them or controlling their thoughts. These are called delusions. Schizophrenia can also make it difficult to think clearly, manage emotions, or connect with others. It's not about being weak or broken. It's about how the brain processes information differently. But here's the truth. With the right treatment, understanding, and support, people living with schizophrenia can lead meaningful, fulfilling, and productive lives. Recovery is absolutely possible. And it starts with awareness, compassion, and care. When it comes to treating schizophrenia, one of the most important steps is finding the right medication. Your doctor may recommend specific drugs that help your brain work more clearly, medicines designed to bring balance back to your mind's natural chemistry. These medications help stabilize the brain's chemical messengers, improving the way you think, feel, and act. They can reduce confusing thoughts, ease hallucinations and delusions, and help you reconnect with the world around you. For many people, medication is the foundation of recovery. It helps create stability, so you can focus on what really matters, your goals, your relationships, and your quality of life. But remember, everyone's treatment plan is unique. What works for one person may be different for another. That's why it's so important to follow your doctor's advice, take your medications exactly as prescribed, and never stop without guidance. With the right support and the right medicine, living with schizophrenia doesn't have to mean just surviving. It can mean thriving. Schizophrenia can show up in many different ways, and understanding the symptoms is the first step toward managing them. Doctors often describe positive symptoms, and no, that doesn't mean they're good. Positive simply means extra experiences or behaviors that are added to normal thinking. Let's start with hallucinations. This means seeing, hearing, or even feeling things that aren't really there. Some people may hear voices, even when no one else is talking. These voices can sound real, but they come from within the mind, not from the outside world. Next, delusions. Strong beliefs that simply aren't true, even when there's clear proof otherwise. For example, someone might believe they're a famous person from the past, or that someone else is controlling their thoughts. These beliefs can feel very real to the person experiencing them, and that's why understanding and compassion matter so much. Another common sign is disorganized thinking or speech. Thoughts can feel scattered, racing, or hard to organize. A person might talk for a long time before getting to the main point, or use words that don't seem to make sense to others. It's not because they're confused on purpose. It's how the illness affects the brain's ability to connect ideas clearly. These symptoms aren't your fault. They're signs that your brain is working differently, not a reflection of who you are. With the right care, understanding, and treatment, these symptoms can improve. Recovery is possible, and so is a meaningful, connected life. When people think about schizophrenia, they often imagine the things that happen, like seeing or hearing things that aren't there. But just as important are the things that fade away. These are called negative symptoms. And here's something to remember. Negative doesn't mean bad. It simply means something that's missing from what we normally expect in daily life. Let's take a closer look at what that means. Some people may show less emotion. Their facial expressions might not change much, and they may not react strongly to happy or sad events. It's not that they don't feel. It's that the illness makes it hard to show those feelings. Others may seem quieter or less active. They might not talk as much, move as often, or join in on conversations or daily tasks. This isn't a lack of interest. It's the illness slowing their mental and physical energy. Sometimes, basic self-care, like showering, brushing hair, or changing clothes, can become difficult. It's not laziness or neglect. It's part of how schizophrenia affects motivation and focus. And often, people begin to pull away from others. They may spend more time alone and lose interest in friends, hobbies, or things they used to love. This withdrawal can make them feel isolated, even when surrounded by people who care. These negative symptoms aren't signs of weakness or laziness. They're symptoms of a real brain illness. And with understanding, support, and proper treatment, these behaviors can improve. Recovery is possible. People can learn to reconnect with themselves, with life, and with the people they love. When people think about schizophrenia, they often focus on hallucinations or delusions. But there's another side that's just as real, and sometimes harder to recognize. These are called cognitive and emotional symptoms. Cognitive symptoms make it difficult for the brain to process and organize information. Someone might struggle to learn or remember new things, even simple details. They may have trouble understanding conversations or following instructions, especially when too much is happening at once. They might also find it hard to make sense of new information or to solve everyday problems, things like planning their day, paying bills, or following a recipe. These challenges aren't about intelligence or effort. They're part of how schizophrenia affects the brain's ability to think clearly. Schizophrenia can also touch the heart, bringing what are called emotional symptoms. Many people experience feelings of anxiety, sadness, or depression. Sometimes, mood changes are subtle but powerful. They can affect how a person connects with others or how they feel about daily life. These emotional shifts can be confusing for families too. But remember, they're not a reflection of who someone is, they're a reflection of what they're going through. Cognitive and emotional symptoms aren't a choice. They're a part of schizophrenia. But with understanding, treatment, and patience, people can learn to manage these challenges and live full, thriving lives. Every small step forward is progress. With the right support, recovery is not only possible, it's powerful. One of the most common questions people ask is there a test for schizophrenia? And the truth is, there isn't one single test that can diagnose it. Schizophrenia is complex. Instead of a quick blood test or scan, doctors and nurses look closely at your symptoms, how you think, feel, and behave over time. They'll perform a thorough medical and mental health evaluation to understand what's really happening. This includes asking detailed questions, listening carefully, and sometimes speaking with family members who know you best. Because some medical problems or even certain medications can cause similar symptoms, doctors might also order extra tests, like blood work or brain scans, to rule out other conditions. This helps ensure the diagnosis is accurate and that you get the right kind of treatment and support. The earlier schizophrenia is recognized and treated, the better the outcome. Early care can help reduce symptoms, improve daily functioning, and enhance quality of life for you and your loved ones. Schizophrenia isn't always easy to spot, but with a careful evaluation, your doctors can guide you toward effective treatment, understanding, and long-term support. You don't have to face it alone. Help is available, and recovery begins with the right diagnosis. When it comes to treating schizophrenia, it's important to know that recovery isn't about a single solution. It's about a comprehensive approach that combines medicine, support, and understanding. Medications are often the first step. They help reduce symptoms like hallucinations, delusions, and disorganized thinking. But here's the key: finding the right medication can take time. Sometimes people need to try different options to discover what works best with the fewest side effects. Side effects are possible, and that's normal. Always tell your doctor if you notice anything unusual. Together, you can adjust doses or try different medications to find the right balance. Long-term treatment is usually needed to keep symptoms under control. Taking your medications exactly as prescribed is crucial. Skipping doses or stopping early can make symptoms worse. Medicine alone isn't enough. Counseling and support are equally important. Family psychoeducation is a special program that teaches patients and their loved ones important skills. Understanding that schizophrenia is a biological illness, not anyone's fault. Learning how to prevent worsening of symptoms. Discovering ways to manage symptoms and reduce stress. Other types of psychotherapy, like individual or group therapy, can also help patients learn coping strategies, build social skills, and improve daily functioning. Remember, treatment isn't just about medicine. It's about understanding, support, and lifelong care. With the right plan, people with schizophrenia can live meaningful, fulfilling lives, maintain relationships, and pursue their goals. Recovery is possible. Support, treatment, and understanding make the difference. Thinking about starting a family when you have schizophrenia can feel overwhelming. But here's the truth: it's absolutely possible with the right support and planning. Before trying to get pregnant, the first step is to speak with your doctor. They can help you understand what's safe for both you and your baby. Most women with schizophrenia need to continue their medications both before and during pregnancy. Sometimes, your doctor may recommend switching to a safer medication that's less likely to affect your baby, while still keeping your symptoms under control. It can be tempting to stop taking medications to protect your baby, but this can be dangerous. Stopping medicine suddenly can cause severe schizophrenia symptoms, and may lead to more intensive treatment later. Here's the key: planning pregnancy with schizophrenia is absolutely possible. With medical guidance, careful planning, and ongoing support, both mother and baby can stay safe and healthy. The right preparation makes a world of difference, and you don't have to do it alone. Pregnancy with schizophrenia can be safe and fulfilling, with guidance, planning, and support. Thank you for watching and taking the time to learn about schizophrenia, an illness that affects millions, but doesn't define anyone. Remember, with the right support, treatment, and understanding, people with schizophrenia can live meaningful, fulfilling lives. If you found this video helpful, please give it a thumbs up and share it with friends, family, or anyone who might benefit from this information. Your support helps spread awareness and fight stigma around mental health. Don't forget to subscribe to our channel and hit the notification bells so you never miss our educational videos on mental health, recovery, and living your best life. Together, we can build a world where understanding, compassion, and support make a real difference for people living with schizophrenia. Thanks for watching, and take care of yourself and your loved ones. Like, share, subscribe, support mental health awareness. I will see you in the next one.